Welcome to PCA Scope of Practice Training, a mandatory training for all Jan and Bev's home care PCAs. Today we will review your scope of practice as a personal care aide and your responsibilities related to special diets. This training is based on New York State requirements, and it is critical that you follow these rules at all times to protect your clients, yourself, and your job. As a personal care aide, your role is non-medical. You are here to assist our clients with daily activities, support our clients' routines, and follow each client's plan of care. You are not here to provide medical care, make decisions about treatments, or perform nursing tasks. Remember this key rule: if it is not in the plan of care, you do not do it. You must follow the New York State scope of practice for personal care aides and your client's plans of care. If something is not in both the scope of practice and your client's plan of care, you must stop and call the office. There are certain tasks that you are never allowed to do, no matter what. This is the most important part of this training. When it comes to client medications, you may not give medication, put pills in a client's mouth, pour or prepare medications, crush medications, give insulin or injections, or handle syringes. You may only remind the client to take their medication. Additionally, you may not perform wound care, apply sterile dressings, take vital signs, check blood sugar, provide oxygen adjustments, or perform any medical procedure. If you are working with a client who has a feeding tube or requires special procedures, you may not assist with tube feeding, provide catheter care, or provide ostomy care. In terms of diets, you may not change a client's diet, give a client restricted foods, or follow family instructions that conflict with the client's plan of care. There are also nail care restrictions. You may not cut nails for clients who are diabetic, or cut nails for clients with circulation issues. There are no exceptions to these rules, not even if the client asks, the family tells you, or if you've done it before. If it is prohibited, you do not do it. Let's review what you can do. You can assist with meals, but you must follow the plan of care carefully. You can prepare meals, assist with feeding unless the client has a feeding tube, and follow the client's diet exactly as written in the plan of care. However, when it comes to nutritional requirements, you may not change a client's diet, substitute foods, ignore restrictions, or decide what the client should eat. For example, your client asks for a piece of cake. You check the plan of care. If it is not allowed, you do not give it. You report the client's request. Even if the family member says, just give it to them, it's okay. You must still follow the plan of care, not follow family instructions, and report it to the office. Your job is to be the eyes and ears of the care team. You must report changes in client appetites, difficulty swallowing, refusal to eat, skin issues, and any request outside of your scope of practice. You do not fix problems, you report them. Let's review. Can you give medication? No. Can you change a client's diet? No. Can you follow family instructions over the plan of care? No. What should you do if you are unsure? Stop and call the office. Remember, always follow each client's plan of care. Stay within your scope of practice. And when in doubt, stop and call. This protects your client's safety, you, your job, and the agency. Thank you for participating in this training. To receive credit for completion, you must successfully complete and submit the accompanying online test. Please proceed to the test at this time.